Привет! Меня зовут Джошуа Леви. Сегодня я хочу показать вам, как мы можем создать интервью между врач и пациент. Это интервью важная часть OET, Occupational English Test. Давайте мы можем посмотреть.
Good morning, Mr. Smith. My name is M. Yes, I will be a physician today, sir. How are you doing, sir?
Good morning, Dr. M. Of course, I'm fine. I'm just really shocked. What happened? I have a pee, and the pee is really dark.
All right. Can you tell me exactly what do you mean by dark urine?
Well, my pee is really dark yellow. It's really bad. It looks
Dark.
quite disgusting.
Yes, sir. Mr. Smith, you said dark yellow or dark brown?
That's a delightfully interesting question. Now let me think. It's dark brown. Actually.
Dark brown. All right. And how long have you had this dark urine?
Well, let me guess. It's been a long time since I had my cheesecake. Since I think, if I'm not mistaken, I reckon last week.
From last week?
Yes.
Can you give me a precise estimation?
Well, let's say last Monday.
Thank you. Did it occur suddenly?
Yes. Actually, I was having a thought about that. I didn't really think and understand as to why it happened. But maybe because I had less to drink. Maybe.
I'm sorry, say it again, sir.
Why, you having some, like problems in hearing me or something?
Oh, a little bit, sir. Yes.
Right.
Can you repeat?
Obviously,
last
people from
phrase?
outside the UK have a difficulty in understanding English. Obviously, yes.
Well,
I
maybe,
totally
sir,
understand.
but I'm not one of that person. Can you just repeat the last phrase, sir?
As I said, I was thinking maybe I had less to drink, so that may be the root cause, but I'm not sure.
Thank you for the answer, sir. Have you noticed any pain during urination?
Any pain?
Yes, sir.
Oh, I rather hope not. Since last week, since I've been having dark brown urine, and I've never been having pain at all. Actually, it's been smooth as anything, really.
All right. Was there any blood?
Was there any blood?
Yes.
Oh, I'd rather no.
All right. Thank you. Have you noticed any specific odor?
No order.
All right. Good.
What is good? What are you talking, huh? Good.
Well, sir, sometimes...
What is good? Huh? What is good? I have problem and you're telling me that is good? Huh?
Oh, I said it's good that you don't have a specific odor of your urine.
Okay.
Please calm down, sir. I'm trying to help you.
I'm calm down, but you're telling me it is good, bad, bad.
Do you have any fever, sir?
No.
Any chills?
There is no fever. No chills.
Sir, can you tell me, is your urine the same color throughout the day? Or
I don't check where do I piss. I think so, yeah.
right. So, and how many times do you go to bathroom, sir, per day?
Oh, 3-4 times per day.
3 times. Yes, all right. And can you tell me before you noticed the change of color?
Noticed?
Urine? Have you noticed?
Are you people are from outside UK, huh? You
Yes,
speak
sir.
English like
Oh,
this?
Yes.
Noticed.
I was born in Russian Federation, sir.
Maybe Russian people speak like noticed. You people like bloody bastards. Come here, take money, take job, huh? Taking passport, huh? You from Russia?
Well, sir, let's do not offend each other, all right? Can you answer my questions?
Go, what you want to say?
All right. So, you said you don't have any fever, right? And chills.
No, of course not.
All right. Thank you, sir. So, and your urine is same color throughout the day, right?
Well, I don't have a check as to where do I pee, but I hope it is the same.
All right. And I was going to ask you, uh, do you urinate the same amount, like, and before you noticed any change of your urine?
Yes. As far as I know, it takes me less than 5 seconds.
No, I mean, you said you go to bathroom 3-4 times per day, right? So
That is correct.
yes, and you used to go to bathroom 3-4 times per day.
And I still go.
I'm sorry, what?
And I still do it.
Yes, all right. Thank you, sir. Do you have any nausea,
No.
any vomiting?
Of course not.
All right. Have you eaten any food that can cause the change of color,
How am I
Of
supposed to
urine?
know that?
or like any beet-covered candies?
No.
Right. Juice, maybe.
No.
All right. Have you had any recent history of trauma?
What? Sorry.
Any recent history of trauma?
Recent history of trauma?
Yes, sir.
No. Of course not.
Can I ask you about your past medical history, sir?
You may.
All right. Thank you. Thank you for your trust, sir.
Well, I'm glad you're doing your job, my friend.
Thank you.
Doctors like you are a passion and asset to this nation.
Thank you, sir.
Even though you look like Chinese, but I'm sure that you're from Russia.
Have you had similar problems before, sir?
Like what? I'm sorry. I beg your pardon, by the way.
Like dark urine?
No, I've never had that.
Have you had any recent infections such as sore throat, sir?
I beg your pardon.
Have you had any previous urinary problems or kidney problems?
No.
Right. Do you have any other medical problems I should know about?
Not that I know of.
Thank you. Can I ask you a question again?
What would you like to ask?
Do you smoke, sir?
I used to smoke, but I have recently made a promise to myself to give up smoking. So no.
And how long have you been smoking?
Since approximately 10 years.
10 years. All right.
Yes.
And how many packs per day, sir?
Packs per day. Now, good. That's a very good question. It depends upon my mood, really. Sometimes when I have a nasty mood, I have about 3 packs per day, and when I have a happy mood, I take 2 packs per day.
Can you tell me how often do you have mood changes?
Well, my mood usually fluctuates with the time of the day, really. When I wake up in the morning, I have a fantastic mood. I want to fly in the sky, like the birds and the bees. And in the afternoon, I've got very bad mood.
Right. Have you ever visited a psychiatrist?
Are you telling me that I'm mad?
No, sir. No, I just asked you.
You are trying to insinuate this notion that I have gone crazy.
No,
And
sir.
I sincerely
No.
detest it.
No.
In all strongest possible terms.
Sir, let me explain why I ask you. This is standard evaluation of patients, and I think you shouldn't stigmatize physician or people if they visit a psychiatrist, because today visiting a psychiatrist is not a big deal.
Psychiatrist.
Psychiatrist. I think psychiatrist is a physician, like family doctor or surgeon or endocrinologist, and I think the more we visit them and talk about our problems, the better it is. So,
Well, I will do as you ask. I'm not really keen and looking forward for a visit to a psychiatrist, but I will do as you ask.
all right. Thank you, sir. Do you drink alcohol?
Sometimes. I'm a big fan of whiskey.
All right. Can you give me a precise amount? How much? And
Well, I have
how
a
much
peg
you
of
drink?
whiskey every now and then, really.
Uh-huh.
Nothing on an everyday basis. Sometimes when I feel happy.
All right. Thank you. Can I ask you about your sexual life, sir?
Why in the world would you ask such a private and delicate thing?
Well, as I said before, this is standard evaluation of patients with urinary problems, and everything you say to me, uh, s- uh, you will stay confidential.
Can you please say it again?
All right. Sir, asking about sexual activity is a standard evaluation of patients with urinary problems, and everything you will say to me, you will be kept confidential.
Okay.
So, are you sexually active?
Yes.
Right. Are you sexually active with female, male, or both?
With only females.
Or only one? So, do you use any type of contraception, sir?
Yes.
Right. And can you tell me what kind of contraception?
Well, I am using a condom.
All right. Thank you, sir. Have you ever been diagnosed with sexually transmitted diseases, sir?
No.
All right. Were any of your partners diagnosed with sexually transmitted diseases, sir?
I have no idea. They haven't informed me of that.
All right. Just check it, sir. Sometimes people, they have trustful relations, and they can give you information about their past medical history. Right. Anyway, so are you allergic to any medication, sir?
No.
Right. Are you taking any medication?
No.
Right. Have you taken any medication before?
No.
Right. Well, Mr. Smith, we have finished our interview, and I would like to conduct medical examinations. And after that, we will discuss our findings and suggested treatment plan. All right? So, is that
Okay.
okay with you?
Okay.
Thank you,
Dr.
sir.
M, if that's what you think.
Thank you, sir. Do you have any questions?
No. How long will it take?
Probably. Well, usually it takes 7 to 10 minutes. So, is that okay?
Well, in that 10 minutes duration, can you please tell me what you will be doing exactly?
During medical examinations, I will auscultate your heart, lung, check your lymphatic nodes, and we will check your genitalia.
Okay.
Is it okay with you?
Yes.
Right. Thank you, sir.
Thank you very much.
Thank you.